This video is a tutorial on how to identify and document the fetal abdomen with ultrasound and what are the required landmarks that you need to show when you are measuring the abdomen. Always begin the exam by confirming the patient name and information such as date of birth and asking for gravida, para, and gestational age to make sure that you have the right patient. In this video clip, this patient is 34 weeks pregnant, and this is her first child, and she is feeling some back pain, but overall she's having a healthy pregnancy. In order to obtain an appropriate abdominal circumference, you need to make sure that you have the appropriate landmarks in the image, and this includes the umbilical vein, stomach, and ribs in lung. And the abdominal circumference is measured starting in the second trimester, and it is an outer to outer measurement and should include the skin and fat in the third trimester too. When you are measuring the abdominal circumference, the heart and kidneys should not be included in your image. And if you can see the heart in the image, you need to move the transducer caudal, and if the kidneys are in your image, move the transducer cephalic. And you can see in the slide that in the middle of the slide, the image in the middle, you can see the heart, which is not a good plane of sound, and the other one, the one on right, you can see the kidneys in it. When you are scanning the fetal abdomen, make sure you confirm there are not any abdominal wall defects, and you need to visualize the cord insert and check that the wall is smooth and intact. And the cord insertion should appear as two parallel lines entering the fetal abdomen, as you see in the image. Abdominal wall defects can include omphalocele and gastroschisis. During a normal first trimester scan, a fetal midgut herniation may be visualized. You can see in this video that this patient is 9 weeks pregnant with her first child, and she is very excited to see her baby for the first time. First trimester midgut herniation will occur between 7 to 12 weeks of gestation, and this is a normal occurrence, and it will regress before the start of the second trimester. After obtaining the abdominal circumference measurement, you need to continue working down the fetal abdomen to display the sagittal kidneys. The normal renal measurement should be between 1 to 4 centimeters depending on gestational age. Then turn the transducer 90 degrees after getting your sagittal image, and take note of the size of the renal pelvis. If it appears to be enlarged, measure the AP diameter. If the renal pelvis appears dilated, pylectasis may be present. The pelvis can measure anywhere from 4 millimeter to 7 millimeter. You can see the measurements in the chart here. As you see in this video, you need to continue moving down the abdomen until the bladder is visualized between the two femurs. And you need to make sure to document a full bladder to prove that the fetal kidneys are functioning properly, and to ensure the fetus is swallowing. If the bladder is empty, check again later, because the bladder fills every 30 minutes. In the same view as the fetal bladder, check for a 3 vessel cord, which is wrapping around the bladder. And colored Doppler needs to be used to demonstrate that you have 2 umbilical arteries. And if only one artery is seen coming around one side of the bladder, a 2 vessel cord may be suspected.